Hi, I'm Michelle Ginsberg. I'm Director of Cardiothoracic Imaging and Vice Chair for Education at Memorial Sloan Kettering Cancer Center. And I'm also a Professor of Radiology at Weill Cornell Medical College. People who have had lung cancer are at a higher risk for second lung cancer. Unfortunately, being treated for lung cancer doesn't exclude you from getting another lung cancer. So in patients who have a history of lung cancer, a major and very common clinical dilemma is whether a nodule that shows up represents recurrence of that primary tumor or represents a second primary lung cancer. During the first 5 years after lung cancer diagnosis, patients that have had surgically resected stage 1 through 3A lung cancer remain at a higher risk of local recurrence and distant metastatic disease. And that rate is actually influenced by the histology of the tumor and the stage of diagnosis. But after a certain number of years, which generally is the year 5, the rate of recurrence drops to 2%. And the rate after that of having a second primary lung cancer is about 1% per year. And unfortunately, that just is cumulative. It doesn't plateau, which means that these patients are at risk of developing a second lung cancer. Now, confirmation that this is a second primary lung cancer and is separate from that primary lung cancer is very critical. And the histologies have to be very different, meaning that that needs to be done generally with molecular genetic profiling to separate the two tumors. And we can further characterize and label them as synchronous. And what that refers to is if the tumor is discovered within 2 years after the diagnosis of the first primary lung cancer, but they are completely separate tumors, they're called synchronous. If that occurs after year 2, they're called metachronous. So as I mentioned, the risk is around 1% per patient per year. And since it keeps increasing over time, it certainly is a risk factor that's significant to patients that have survived their primary lung cancer. And it seems like the incidence of a second primary lung cancer is the same in those that have never smoked and had resection for an early stage lung cancer with those that have never smoked versus ever smokers. So whether you smoke or not, the risk of having the second primary lung cancer seems to be cumulative. And for example, a 10-year cumulative incidence could be around 20% for these patients, which is something quite significant.